Ms. Emma Jeff, the CEO of Zambia, to be hearing us.
Distinguished ladies and gentlemen, and all protocols observed. Sound Seekers has been working in Zambia for more than 10 years, initially providing outreach services and equipment, and more recently sponsoring nurses to undergo audiology training and improving the school environment for learners with hearing loss. There are many people to thank for the success of the opening of this clinic today, so please forgive me for not doing so to all individually. I would like to give special thanks to CBN and the Stay Easy, who generously helped to sponsor this event, and to all the donors who contributed to this project. It is their goodwill and belief that has made the opening of the clinic today a reality. I would also like to thank Dr. Alfred Mwamba, the only Zambian audiologist, who has been instrumental in supporting the development of audiology services in the country. Dr. Masuku for his interest and ongoing commitment to the development of the audiology clinic, and our volunteer audiologist, Bavisha Palmer, without whose extraordinary dedication and work, it wouldn't have been possible to implement this project. But this clinic is only the beginning. After all, what use is a clinic full of equipment if there is no compulsory screening in schools to ensure early identification of children with hearing loss, and no simple referral process to ear and hearing care specialists? Every child has the right to education and deserves the opportunity to learn. Disability should not be a barrier to that. Hearing loss must not be a barrier to that. But sadly, that is the reality for many children with hearing loss in Zambia. In 2016, there were almost 18,000 learners with hearing loss in grade 1. By grade 8, this number had dropped to less than 7,500, and by grade 12, fewer than 1,600 children with hearing loss remained in school. The World Health Organization estimates that the lack of attention towards hearing loss poses an overall annual cost of $750 billion globally. Investing in health and education services and delivering them as integrated and comprehensive programs will ultimately help governments reduce the economic burden of hearing loss. With the help of our partners in the Zambian government and other civil society organisations, Sound Seekers is working to ensure people with hearing loss become empowered to make valuable contributions to society by improving their access to health and education. But this can only be achieved through teamwork. And here, if I may, I'd like to mention football. Not least because the numbers of African audiologists are akin to the football scores in the Africa Cup of Nations. Sierra Leone 0, the Gambia 1. Zambia 1, Malawi 3. When Zambia won the Africa Cup of Nations in 2012, they achieved the impossible and became champions of their first continental title against all the odds. They fought the giants of African football, overcoming great adversity, and won, proving that anything is possible and that by working together as a team with an ardent belief in the cause, miracles do indeed happen. I believe that as in 2012, Zambia can take another continental title and become the champions of ear and hearing care in Africa. By all of us working together to train more audiologists and more audiology technicians, to identify more children with hearing loss, and to ensure their access to health and education, Zambia can become the pioneer of Africa for delivering comprehensive audiology and educational services. Working as a multi-sectorial team, we can do this. Alone, we can't.